Welcome everyone to the Bite-Sized Mental Health Podcast. Let me just give you a brief introduction for those of you who've never heard me speak before. My name is Brandon Santan. I have a master's and a PhD in mental health counseling. I'm a licensed therapist, currently practicing private practice in Chattanooga, Tennessee. I'm also a business owner where I own my own practice. After my graduate program, I worked for about 8 years at a local hospital part-time and also part-time in private practice. Then I moved to full-time private practice with a group, and then I started my own practice, and I've been doing that ever since. Also, let me give you a quick disclaimer here. Please keep in mind that this presentation is for informational and educational purposes only and should not be misconstrued for medical advice. Always check with your doctor before implementing this information. Now, with that out of the way, let's dive right in. In this episode, I'm going to review 5 things that we can each do to improve mental wellness. I was interviewed by Authority Magazine for this, and I just wanted to say I'm really grateful to Authority Magazine for working to bring this to public awareness. We definitely need more awareness in our society, and we, I think, are long overdue for reducing the social stigma around mental health challenges. So, again, I'm really thankful to participate in this interview. I hope that what I share will be beneficial to a lot of people and that we can start making more of a movement towards mental wellness. I'd like to start just by clearing up a proper definition of mental wellness. So this will be in contrast of mental health, which is the typical term that we hear, but I really like the term mental wellness because it provides what we would consider a wellness narrative around mental health. So rather than thinking of it in binary kind of healthy or not healthy terms, we can consider mental wellness really in much the same way that we would consider physical wellness. This is the narrative that says I'm not as well as I would like to be, so I will be improving my health or my well-being. Now, of course, with the brain, since the brain is an organ, a physical organ, it can become diseased. So some mental illness really is physical illness, but when it comes to the brain health will often define mental health and vice versa. So keep that in mind as we move along here. There are a ton of things really that can improve or optimize our mental wellness, but I was asked to give 5, and since we're talking about wellness here, I wanted to stick with more of a holistic framework or model of health, because that's what I personally think of when I think of wellness. So with that in mind, here are my 5 steps that we can each take to improve or optimize our mental wellness. Number 1, assess your micronutrient levels. For those of you who aren't familiar, quickly, micronutrients are the vitamins and nutrients that we get from our food. You think of macronutrients as the categories of foods that we eat, such as grains, dairy, protein, things like that. But micronutrients are the vitamins and minerals that we get from our food that our body extracts during the digestion process. So what a lot of people don't realize is that these nutrients can be diminished for a lot of different reasons. The key nutrients that are related to mental wellness are vitamin D, folate, and B12. So see a nutritionist or ask your doctor to check these key nutrients, and you may be surprised at what you find. Interesting story here. During my graduate program, I had a professor who would always turn up his nose at the idea of using supplements, saying that, in the United States at least, we get all our nutrients from our diet, and supplementing only serves to make you have quote-unquote expensive urine. In hindsight, I think that was a very irresponsible message to send to young clinicians. What I would come to realize later is that roughly half of the population have genetic mutations or morphisms on key vitamin and nutrient receptors for mental well-being, such as vitamin D, folate, and B12. These genetic mutations cause deficiencies, and they make it difficult for our bodies to keep those nutrients at optimal levels. These genetic anomalies also often prevent people from metabolizing synthetic vitamins, which is what's put into our foods during the refining and enrichment process. So what these companies do, these food manufacturing companies, is they process and refine the foods, which is a process that kind of strips out or reduces the natural vitamins and nutrients. So in order to overcome that, they infuse or enrich vitamins back into the food. But the problem is, in order to keep costs low, they use synthetic vitamins. Now also add to that things like being indoors longer and more often, which prevents us from getting the amount of sun exposure we need for something like healthy vitamin D levels. And you really do start to get somewhat of a recipe for vitamin deficiencies and nutrient deficiencies. When I was working at the hospital, the psychiatrist gave everyone vitamin D and B12 supplements indiscriminately. Every patient who walked through that door, as part of their medication protocol, got vitamin D and B12. We know that these are nutrients that are vital to mental wellness, so it's really important to assess at least these 3 key vitamins and nutrients. Now, sometimes people will go to their doctor and the doctor will test these vitamin or nutrient levels, and the doctor will say, well, these are within normal range, so there's nothing that we can do. If that's the case, just double check and ask your doctor about what's called subclinical deficiencies. These would be deficiencies for you individually. Maybe they fall within the textbook clinical range, but for you, for your genetic data based on your metabolism, they may be what we call a subclinical range. So again, some people's test results fall within the clinical range, but would be considered abnormal for the individual who has a certain genetic profile. If your doctor recommends supplements, look for high-quality supplements that contain natural ingredients. For example, L-methylfolate is a good option for folate supplementation, not folic acid. Folic acid is the synthetic form of folate. That's the first one I look for when I'm looking for a supplement. So typically if you see something like L-methylfolate instead of folic acid, then the rest of them will be natural ingredients as well. So look for that. Make sure that you find supplements that are bioavailable and what we would think of as liposomal. They're easier for your body to digest, so especially if you have GI or intestinal issues, you want to look for liposomal vitamins. One important thing to consider here as you're talking with your doctor is a genetic test. There are a couple companies in the United States that offer genetic testing. So this would be genetic profiles specifically designed to help you and the doctor understand what nutritional deficiencies would come into play or what medications would be necessary for your particular genetic profile. Genomind and Clarity X are 2 that I've looked at that look promising. So if your doctor's a little bit skeptical, ask if you can do one of the genetic tests, and then you and your doctor can sit down and go over the results together. So let me just give you an example here about why we're seeing some vitamin and nutrient deficiencies. In the US, the Food and Drug Administration, or FDA, is responsible for regulating food ingredients and nutrients and things like that. And they make recommendations based on the research of what a daily recommended allowance is for a particular vitamin or nutrient. And in the US, the FDA recommends 500 international units of vitamin D daily. According to research, though, we get roughly 10,000 international units from the sun on a sunny summer afternoon spent outside. So with this example, we can see that the FDA is severely under-recommending vitamin D, and it seems to be having quite an impact on mental wellness. So that's something that needs to change. We're in the process of changing that, and I hope that we get there soon. Now again, just a general disclaimer here, always check with your medical doctor before using any supplements. Make sure that they're appropriate for you, but I really think that this could be a huge game changer for a lot of people. So consider this when you're thinking about improving or optimizing your mental wellness. All right, number 2 is exercise. How could I have a presentation on mental wellness or holistic wellness without exercise? It's pretty common knowledge, I think, that exercise is crucial to physical health, especially as we age. And again, the brain is a physical organ, and as such, it benefits from physical exercise. Increased blood flow, better physical efficiency, and higher oxygen levels, they all have tremendous benefits on our brain health, as well as our mental wellness. Researchers have discovered that for some people, exercise is actually just as beneficial as an antidepressant in healing depression. It may even be more beneficial in certain instances since exercise increases overall health. Again, check with your medical doctor before implementing an exercise routine just to make sure it's appropriate for you. and ask what type of exercise you should do. But please consider being more active in some way. It is, without a doubt, tremendously beneficial and helpful to our mental wellness. All right, moving right along here to number 3. This is probably one of my favorites. Find a provider that will image your brain. Now, this may seem a little bit weird to a lot of people simply because it's not common practice for a doctor to take an image of your brain. But there's a prominent psychiatrist based in the United States, in the state of California, who is really pioneering what we would think of as brain imaging related to mental health treatment. And I like to echo his sentiment. He shares concerns about prescribing providers in our industry, and he says that we're the only industry that has prescribing providers who treat a part of the body they don't regularly image. When I first heard that, I was kind of blown away. I mean, think about that for a minute. If you have an irregular heartbeat and you see a cardiologist, the cardiologist will do an ECG and an ultrasound. If you have joint pain, the orthopedist will do an X-ray and a CAT scan and maybe even an MRI if it's soft tissue related. But think about it. When have you ever heard of a psychiatrist doing a brain scan before prescribing a particular treatment protocol for a mental health disorder? It rarely happens. Dr. Amen has, again, become somewhat of a pioneer of this particular modality of treatment and assessment, and he's established clinics throughout the United States now, and one of the first things his team, his clinicians do is perform what's called a SPECT scan of the brain. This is just a special imaging that shows blood flow and brain activity. And it really helps providers see what parts of the brain have diminished blood flow or diminished activity so they can implement the proper treatment protocols. This also includes precise prescription medication and correct supplements. Really, really interesting research. So if you haven't thought about this before, please check it out. It's proving to be tremendously beneficial to a lot of people in targeting the right kinds of treatments for mental wellness. All right. Number 4 is consider additional and alternative treatments. Now, this one is a little bit controversial, very similar to imaging. I get a little bit of pushback from colleagues and prescribing providers in my industry, but the number of alternative treatments are growing, and each year we get closer to perfecting many of these different treatment protocols. Lots of research is being done. There's lots of studies that are coming out to show how efficient and effective these treatment protocols are. And they can really serve to supplement medications and other types of traditional talk therapy that people do. These alternative treatments include things like biofeedback, EMDR, which stands for eye movement, desensitization, and reprocessing. Started out as a treatment protocol for trauma resolution, but we're finding it helpful in a lot of other ways as well. Hypnosis, transcranial magnetic stimulation, or TMS, cranial electrotherapy stimulation, or CES, which isn't quite as scary as it sounds. It's actually pretty easy. Virtual reality, psychophysiological coherence training, and vagus nerve stimulation. These are all examples of supplemental and alternative treatments for mental wellness that are becoming more popular and more well understood and more used and very versatile. These alternative and supplemental treatments are among the top contenders currently for mental wellness promotion. In Chattanooga, where I practice, we have a psychiatrist whose name is Tim Jennings, a medical doctor who treats patients with traditional medications, but also offers the transcranial magnetic stimulation for treatment. I've spoken with him several times about this treatment protocol, and it does seem to have a higher than average success rate. TMS, from what I understand, is even FDA approved to treat depression. So don't discount alternative type treatments. Give it a try, do a little bit of research, ask around, get some consultations, and you may actually find something that works well for you. And finally, number 5, consider medications. Now, I realize this suggestion may seem a little bit antithetical to a theme of holistic mental wellness, but I've lost count of the number of patients I've worked with over the years who were hesitant at first to take medications, but did so later and ended up stating to me in one way or another that they wish they started medication sooner. So keep in mind that taking medications doesn't mean you'll have to take them for the rest of your life. What I like to explain to patients is that medications are kind of like a life preserver when you're stranded in water. It helps you keep your head above water during rough times, Maybe you don't know how to swim, you put on floaties, it helps you work through the motions of swimming so you feel more confident. And then once you quote-unquote learn to swim in therapy, that is, develop strong, healthy coping skills, or you end up getting out of the water, that is, you enter into a remission state or enough healing where you can go it alone, you can take off the life preserver. With your prescribing provider's help, you'll be able to wean off these medications and continue to grow and change in therapy and in your own development of life and coping strategies. In considering medications, I want you to know that it's best to find a psychiatrist or psychiatric nurse practitioner to discuss medications for mental health. Primary care doctors will prescribe these types of medications, but most primary care doctors have somewhat of a limited knowledge of the broad scope of medications, or they have a few they like to prescribe for everyone based on what works for the majority of their patients. There's nothing wrong with this. This is an okay way to do medicine, but it might not be a bad idea to get a consultation with a psychiatrist or a psychiatric nurse practitioner. These are providers who can prescribe medications, and they specialize in prescription and management of psychiatric medications. So they have to go through these specialized training programs and fellowships and internships and practicums, and they get really, really good knowledge about these medications and can manage them well for most people. They get really broad knowledge of the various kinds and formulations of these types of medications, and they can often find something that works for you much more quickly. In addition, if you decide to see a psychiatrist, talk to your psychiatrist about that genetic testing. Again, just as a reminder, there's a genetic profiling test called Genomind, and also another one called Clarity X. And in the results of the genetic test will be included a list of medications that are likely to work well with your genetic profile. This makes targeting the right medications for you individually much easier and much more efficient. So I've talked with a lot of people who've done this. There's been a lot of success in this method of medication evaluation. So talk with your psychiatrist or your primary care doctor about this. Well, that's going to wrap it up for this episode. Make sure to hit that subscribe and like this so that you can be notified of future episodes, and we'll look forward to seeing you there.